What steered you towards the ABOP as opposed to some of the other advanced trainings that are out there in the world of TMJ dysfunction?
Well, when you look at TMJ dysfunction or TMJ disorders, that is part of a complex history. I mean, whenever somebody says, well, do I have TMJ, for instance, or do I have TMD, which is temporomandibular disorder, I'm going to ask, which of the 40 plus diagnoses are there? Because to say you have TMJ is the same thing as saying I have knee. When we talk about disorders, that's kind of a catch-all term. So, dentists are trained basically how to manage temporomandibular disorders, and typically involves bite splint therapy. And a lot of continuing education programs do a nice job of teaching basic TMD therapy. But when you get into complex TMD syndromes and all of the headaches that are related to it, and sometimes neuromuscular disorders associated with it, it gets very complex. So how did I get into it? Basically, I did not like always wondering what else could be done when I couldn't get patients completely out of pain. And so I just started taking courses. And that led me down the path of AAOP, which is the American Academy of Orofacial Pain courses and symposia that I went to. And then I started looking into, well, what would it take to become a specialist when I started hearing that. And that's kind of how I just kind of, it was a progression of my continuing education, just of an area of interest.